skin, we have the epidermis, the dermis, and subcutaneous layers. I'm just doing this because some people may not remember their skin set. We're going to go to a better picture of sweat glands, because sweat glands, we need to know both kinds. But questions about this? This little diagram. Or is AMP coming back? Good. Here are our sweat glands for comparison. Here's an eccrine sweat gland. Where are our eccrine sweat glands mostly? Most of our palms as well. Most of our body is covered with eccrine. Where are our apocrine glands?
Here.
Underarms, axilla, groin, and they're usually associated with the hair follicle. Nasty things that happen to skin. This poor child has Stevens-Johnson syndrome, which is a toxic effect from some drugs. It's an autoimmune reaction to the drug, and it causes all the skin on the person to slough. So they appear massively burning. This is another autoimmune reaction. This is eczema. We find eczema on our hands, on our fingers, sometimes in the creases of our body, but typically hands. This is discoid lupus, which usually occurs in women, but it's like lupus except that it creates these kind of ring-like red marks that are painful, and they can cover the whole body, but they're most common on the face and the arms.
What's it called again?
Discoid lupus. Autoimmune, so our body is attacking itself. This is seborrheic keratitis or seborrheic dermatitis. It depends on what you want to call it. It occurs in the oily parts of our skin, so the nose, the scalp, the ears. It creates these flaky areas that are red, and they tend to be kind of crusted with yellow. So it's not really dangerous, it's just more of a nuisance.
Is it like our oil?
I don't know what the exact patho is, but it tends to, it's always associated with
What was it called?
sebaceous, it's seborrheic dermatitis.
So is it just on the scalp?
Nose, so we've got oils here. Anywhere you've got abundance of oil, and it tends to be ears, nose, scalp.
So it goes inside the ear
Yes.
as well?
Uh-huh. And actually, what people respond to is they think, oh, I have terrible dandruff. And so they wash twice a day with soap, and that worsens it. Because then the oils come out even more, they try to replenish, and you can get these big yellow crusts over these areas. So, again,
Just say that name one more time.
seborrheic dermatitis. And if you think about that, the sebum, which comes out of those, the oil glands, that's where the sebaceous, yeah.
That's why Steve's got to be like that.
So this guy's got it on his head. It's kind of bald.
Does it cause balding?
Huh?
Does it cause balding?
I don't think so. Cellulitis, this is an infectious process caused by bacteria, where they live in the dermis and they proliferate and go through the skin, and it usually smells bad, but it causes these big red areas that are basically just swaths of infection. You can see it too on the legs quite a bit, anywhere where there's poor hygiene. In between the folds of a morbidly obese person, you can find cellulitis. But yeah, bacteria. Another infection, herpes. This is herpes simplex type 2. Type 2 is genital. Type 1 is oral. So
Don't a lot of people get type 1?
quite a few people have type 1. And babies can get type 2 from natural vaginal birth. So it affects everyone throughout the whole lifespan. But it causes these really interesting, crusty, pustuly things. So, and they tend to make little mats. So you'll see a mat of it on the face for type 1, or you'll see mats of it on the penis and the perineal area for women. We'll talk a bit about management for this. This is shingles, which is a varicella type. So this can happen post-chickenpox. So if you ever have chickenpox, you might get older and then have this. It hangs out in nerve cells, lays dormant, and then decides to pop out. Yeah.
Are they just painful and not itchy?
They start itchy and they progress to painful and oozy. So people go, what am I allergic to? Oh, pustules. So people can sit there and smear Benadryl and smear hydrocortisone on it, and then suddenly it looks a lot like herpes.
This goes on for years.
Yeah, it can go on for a long time, and even after it's healed and there's no evidence, we can still have pain. Yeah.
So if they hang out in nerve cells, can you get tested to see if you have it?
If you've had the chicken pox, you are at risk for shingles.
Okay,
They
so
have a
then
shingles
it's,
vaccine.
They do have a shingles vaccine.
but you can't get it that when you're older, like
Yeah.
60.
Right, and that's because the most people, some people our age get it, you know, in your teen or your 20s, you know, you can get shingles. But our most at-risk clientele are our elderly. And so I think at 55 or something, you get the Zostavax shot. So, questions about this? Okay. This is common. This is a common area, abdomen and trunk. Shingles, shingles, shingles. Fungus, this is ringworm, or does anyone remember the actual clinical name? Tinea corporis. Ringworm. Where else does it show up?
Tinea
Scalp.
pedis, tinea
Like
capitis,
And capitis.
yeah.
And
Is there one? I think that's it.
Yeah.
Foot, groin,
That's pedis.
scalp, and then body. We'll talk about management with that too right now. So pertinent skin drugs. Isotretinoin or Accutane. This is a very serious drug. It tends to be very liver toxic. It's category X for women thinking about pregnancy. It's a huge teratogen risk. And it can cause spontaneous abortion. So when you start this drug, typically you'll take a pledge if you're a woman and say, I promise not to be pregnant.
put you on birth control.
Yeah, and they might do that as well. But there's an I pledge program with this drug. But
So is it for her or for the fetus? So is it for, in protection, you're taking?
it is for the
for
mother,
her?
potentially. It's for acne. Sorry, I probably should have started there. This is for acne. So for severe, recalcitrant, hasn't responded to anything else acne, we can give this drug.
And you have to be blood tested, get your blood tested once a month.
And that's for liver. This can make your liver
And it
dead.
causes like,
It has a black box warning for suicidality.
because it affects your,
Yeah.
You have to
Is that
really
it?
want to control your acne to take it.
Generic name of Accutane?
Isotretinoin. Yeah. And I tend to favor the generic names because trade names change. Generic names don't. Isotretinoin we're taking for acne, for severe acne. This is not first line. This is everything else has failed acne. But remember, bad for babies, can cause suicidality, especially in teens, bad for your liver.
And bad, don't go in the sun.
and she also,
Right, it
she
could
also,
make you photosensitive,
she
but
also mentioned that your skin gets like extremely flaky dry, like it'll just flake off,
that's
so.
right.
Is it? Accutane does that too.
Does it?
Yeah.
Okay,
Like your lips
I'm thinking
get
of
really
Renee
exposed.
when I think that, but I'm sure it does. It's just, I don't know, my personal opinion, don't take it. Cleocin T, clindamycin, this is an antibiotic. We can smear it on our face for acne. This is more what you'd start with. So you've got to clear up, you're going to reduce your dermal bacterial load. So we're going to put on some Cleocin T each day. This will make you photosensitive. This can burn. You can have allergic reaction to this, just like any antibiotic. Clotrimazole. What does this azole ending indicate to you? Antifungal. Anytime you're seeing blah blah azole or such and such azole, you're thinking this is for the management of some fungus. Clotrimazole we use on our tinea, whatever. So we can use it on our jock itch, our athlete's foot, our ringworm. It's good for that. Over the counter even as Lotrimin, I think. So, sometimes it's in combo with other drugs. Similarly, we have an azole ending. Ladies might be more familiar with this. But it actually, you can use it topically too for candidal infections.
Use it on my ovaries before too.
So this is for what we might call yeast infections, but it's really for vaginal candidiasis. Yep. But again, Azole, we're thinking fungus management. Questions? Nope. Okay, Zovirax. This has the word virax in it, or it ends with vir. And that means we're putting it on our skin to manage a virus. This is what we're giving for our herpes simplex. So our type 1, which is circummoral. I don't know if this is for genital herpes, but I believe it is. But this is not a curative agent, this is a management agent. So it will reduce an acute outbreak of herpes. This is a synthesis inhibitor, so it prevents the virus from entering the cell and keeping going. All of these are on the drug sheets. So this is the tretinoin cream, or sometimes we'll call it vitamin A acid. You put it on your face. It can cause horrible redness and peeling. Typically patients, after they put it on, feel really hot and flushed. This will contribute to sunburn, so don't go out in the sun after you've done this, otherwise your face will fall off. So you're going to spontaneously combust. Not really. But what else? Neosporin. This has a 3-drug combo, neomycin, polymyxin B, and bactracin. This is stuff that we can put on cuts as a preventative. We can also manage minor infections with this, although a lot of infections don't respond to it anymore. But I would know that, know the drugs. Sometimes they're separate, but usually they're used as a trio. And finally, Bactroban ointment. This is used for MRSA. It's also used for other kinds of staph or strep infections of the skin. It's very effective. We can put it in people's nose. We can put it on their skin, because a lot of people carry MRSA dormantly in their nose. My clinical instructor said if you're going to go to the hospital, smear some of that up your nose before you go so that they don't put you in isolation for no reason. But Bactroban, mupirocin is the generic, but Bactroban is the trade name. And you wouldn't be able to read that if it was a crappy picture. And finally, benzoyl peroxide. This is another first line for acne. It's a peroxide, so it's going to lyse our bacteria on the skin through that mechanism. Are there any questions before I move on about any of these drugs? They're all on the Derm drug sheet. Okay. Real quick.